Hi, good morning, everybody, or good afternoon, or even good evening. Uh, Hello, everybody. Welcome to our live session today. Today is April 15th. Happy High Five Day. So I want to congratulate everybody for all the hard work you've done virtually. Thanks for being here. Thanks for putting in all the hard work. I will be going over a quick startup presentation to welcome you all, introduce you to our program, and opportunities if you have previously attended our shadowing session. And so pre-health shadowing is a student-led, minority-led, and women-led nonprofit dedicating to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. My name is Nee. I am the co-host today at Pre-Health Shadowing. Thank you all for attending today, and let's get started. And so just a little PSA, as usual, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you ever need any assistance enabling the transcript, please do not feel afraid to direct message one of our lovely team members here today. We are always looking for ways to be more inclusive and ensure our sessions are accessible to every single person. So please, if you have recommendations for how we can improve, you can always email us at info@prehealthshadowing.com. And so obviously this is an international program. We want to know, where are you Zooming from today? Drop it in the chat. Florida, that's cool. Exciting. All right, people all over the West Coast, all over the East Coast. So cool, so exciting. And so moving on, if you want to stay in the loop, follow us on social media. We are active on Instagram and TikTok because we're super duper trendy, or sign up for our email list on our website to never miss a session. We have some absolutely amazing opportunities for you all as benefits for being a part of our program. We have partnered with Kaplan at the tippy top to get you guys a 10% off discount code that can be used on all Kaplan products, as well as free resources, such as study guides to help prepare you for success on standardized tests like the MCAT, PCAT, and the NCLEX. If you fill out our short survey in the chat, you will get hooked up with this. So it's a great resource that I think everybody should use. And so we would also like to draw your attention to another amazing program towards the bottom of your screen called Neolith. Neolith is an online mental health platform for students. College and young adulthood is stressful enough as it is during normal times. So imagine now. For pre-health professionals especially, we know the path is not easy. That's why we have partnered with Neolith to give you guys free access to their services if you use the link in the chat or enter the code PREHEALTH when signing up. And so we here are a women-led nonprofit, and so we would like to recognize Mask for Mask. Mask for Mask is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic. There are so many, but we would like to recognize those in the homeless community, healthcare workers without proper PPE, and others who are just struggling to stay safe. With our discount code PHS15, again, PHS15, you can get 15% off of your order. If you buy through this method, pre-health shadowing will also get 10% of the proceeds, which is absolutely amazing because we are a nonprofit that runs solely off of the support and work of our students. Next, if you want to play a bigger part in supporting PHS, like I know you love us so much, we would love for you to join our network of student volunteers and team members like me. You can apply to be a part of our administrative team and lead students in various projects, initiatives with professional outreach, grant writing, and everything else under the sun. We understand that as a pre-health student, you may not have the time, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be a part of this program and contribute your own unique perspective. Next, if you are a young high school student and you want to get involved, and because you are so brilliant and smart, you know what future you want. We are starting a program called HTP, or High School Training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, and organize resources for other high school students interested in medicine through pre-health shadowing. We want to recognize the hard work of all of our students in the program. So if you're interested in getting published and getting your name out there, you could submit all sorts of writing pieces, reflections, research papers, essays, maybe perhaps a book. And then those can go to our editor-in-chief through the link dropped in the chat to have your work on our website. This will look on great on CVs, applications, resumes, and so much more. So take advantage of this. Part of our mission at PHS is to promote diversity. And so in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these events, we have done an all-female panel in the past, but others will include a COVID-19 roundtable, an international student forum, and so much more. And if you have a mentor, professor, or professional who has inspired you and could contribute to these conversations meaningfully, nominate them today using the link in the chat. Now, if you can, we humbly ask that you donate to our program. As I have said, pre-health shadowing is completely student run, and we are working all around the clock to keep this free and accessible to everybody. Unfortunately, these platforms are not by any means free, so any contribution you can give would be greatly appreciated. And so if you're not financially able, we request that you send this link to someone you think can in order to continue to support those who cannot afford similar opportunities. Throughout this session today, we encourage you to drop any questions, comments, thoughts that you have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session during the Q&A. So make sure your voice is heard. And also, if you want to, you can also raise your hand and speak up for yourself. As you can see on the screen, take good notes like class, as our professional is going over their presentation, as there will be the chance to take a post-shadowing assessment. 10 questions, very simple if you pay attention and interact, to verify your virtual shadowing hours. More information will be available on this at the end of the session, so please stay tuned. Lastly, if you are still alive and still paying attention to me, we request that you turn your cameras on. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. I appreciate you all for listening to my spiel, and now I would like to welcome our professional today. Thank you so much for joining us today. You may share your screen whenever you are ready. Thank you.
Okay, you ready for me to start?
Yep, go for it.
Okay. Hi, so by way of introduction, my name is Stephanie Peshek. I have, I got to stop reading because, I'm seeing like, that's not the right name. But anyway, my name is Stephanie Peshek. I am currently a pharmacy professor at the Lake Erie College of Osteopathic Medicine, or LECOM, College of Pharmacy in Florida, in Bradenton, Florida. And in our program, we have 3 pathways. We have a distance education pathway that is all distance education, other than a few weeks in the summertime when the students come to the campus and do some labs and things that need to be done in person. We have an accelerated program that's a 3-year program in Erie, Pennsylvania, and we have a traditional 4-year PharmD program in Bradenton, which is the one that I'm mostly teaching at. This first slide that I put here is sort of a summary of my pharmacy career, starting with my dad, the pharmacist, who worked in a community pharmacy. And I used to go visit him and sit on the counter and count M&Ms in one of those little pill counting trays. And I used to joke with him that, he was lucky that it turned out the way it was, instead of counting the pills and putting them in my mouth and ending up with some other fate as a career. But and then this most recent picture is from last year when my second book came out. So it's from the infancy to the current status. So I want to just kind of introduce, and I'm sure a lot of you, if you're in some type of pre-health career, you probably know a lot of this, but I'm going to, kind of start with the basics. What's pharmacy about? So the degree, the terminal degree that you get with to be a pharmacist is a doctorate of pharmacy, or PharmD degree. There are several paths to get there. There are schools that require only the prereqs as an undergrad, and then you go into the 4-year doctorate program, professional school. There are programs that are a 6-year program from high school graduation to the PharmD degree, and some different things in between. Some programs require a bachelor's degree before you go to the PharmD program. So the prereqs are mostly, as what you would expect, science type things, some math, things like that. And like I said, there are sort of different pathways to get to the admissions into the PharmD program. Pharmacists do all sorts of different things, and I'll talk more about some of the different areas that you can practice pharmacy. I know a lot of people think of, and my husband is one of the people who thinks of pharmacists as a little old bald man with a bow tie, because that was in that Christmas movie. I can't think of the name of the Christmas movie, but the movie with Jimmy Stewart, and he, has a little angel that comes and makes him realize A Wonderful Life. That's it. It's A Wonderful Life. Anyway, the pharmacist had made a mistake, and Jimmy Stewart helped him. And anyways, a little old man with a bow tie. And my husband always told me that that was his picture of a pharmacist. And I think the current picture is often someone who works in a retail pharmacy, whether it's a CVS or a grocery store or a Walgreens or something like that. But there are a lot of other places that pharmacists practice, and I'll talk a little more about that. And if you have questions, feel free to ask. A lot of the practice of pharmacy does deal with taking care of patients and working with other healthcare professionals. A lot of the different areas that you can work in pharmacy are also dealing with what we call value-based clinical services. In other words, trying to find a way to share the best value and use our resources to get good health care for as many people as possible. We deal a lot with regulation. There are lots and lots of rules. As you can imagine, anything that has to do with drugs, especially controlled substances, require lots of laws and different regulations that we have to learn and abide by. There are all kinds of insurance things too, which are pretty much true in every area of healthcare, and maybe not as bad for the person who said they came from London. Things might be slightly different, but in the United States, there are a lot of things that are regulated by the insurance companies that pay for our services. Pharmacists are involved with advocacy, talking to legislators about how to get better healthcare outcomes for patients. And there are leadership opportunities in pharmacy, which again, I'll talk a little bit more about later, and a lot of professional organizations that you can be a part of. So my experience, I started out, my first job after I finished pharmacy school was in a CVS community pharmacy. I didn't last real long there. Less than a year later, I actually, on one of my last rotations, so the last year of pharmacy school is usually experiential rotations. And one of my last rotations was in a hospital. And I went with my preceptor to a meeting and sat next to someone who just happened to be complaining that her favorite pharmacist was moving because her husband was relocating and they had to move to another state and she needed to hire a new pharmacist. So I had that in the back of my mind when something kind of went wrong. It was a bad day at my community pharmacy job. And so I went out in the parking lot and called this woman and said, "Hey, did you hire that pharmacist you wanted to hire?" And she said, "No, I'm just writing an ad." And I said, "Well, interview me first." And so I ended up going for an interview, getting that job. She retired shortly afterwards, and I ended up being the pharmacy director at a small hospital at 24. So I felt a little ill-equipped to be managing people who were all older than me and dealing with the people from all the other departments in the hospital. So I went and got an MBA in healthcare management. And I felt like that helped me a lot to just understand what was going on in all the other departments of the hospital, to understand budgeting and things like that, which I hadn't really prepared for because, like I said, my career took a little turn, and it was not that well planned for me. I then, when I went back to school back in the last century, when I first graduated, you needed a BS in pharmacy, a bachelor's degree, to get a pharmacy license. So I had my license and a bachelor's degree, but I saw the changes coming and knew that you needed to have a PharmD to excel in clinical practice. So I went back to school to get my PharmD. While I did that, I worked part-time as a nursing home consultant pharmacist, and I'll tell you a little more about that. And once I got out, I ended up being a pharmacy director for a big healthcare system and dealing with a lot of clinical initiatives and things like that. And then I now am in academia and teaching pharmacy school. So I've done a lot of the different types of pharmacy practice that you can do, but not all. So here's a couple of my places. The little tiny hospital that I worked at first is now a parking lot for the Cleveland Clinic in Cleveland, Ohio. And these are some of the other hospitals, the CVS where I started, and this is a group of my colleagues at the college where I currently work. The fun thing about being in academia is every year you get to put on the cap and gown and participate in graduation. 3 of my career goals in the time that I've worked as a pharmacist have been to create balance in my life and the lives of the people that I worked with, between yourself, your family, your professional organizations, your career, and try and balance all those things so that they're all positive experiences. Combining patient outcomes with financial outcomes. A lot of people in the hospital that I would meet in different meetings and committees and things would think all I cared about was the pharmacy budget. But I was able to convince a lot of them that that wasn't the important thing. The important thing was getting the best outcomes for our patients. And the last hospital that I worked at was one of the leaders in indigent care in the state of Ohio. And so we were well known for taking care of patients and having good clinical outcomes, regardless of the financial impact. But we managed to do what I called that value-based care, to kind of figure out how do we allocate our resources to be able to get the most for the most people. And then promote the practice of clinical pharmacy and help pharmacists get the jobs that I would like to be doing. I'm very proud of having created a lot of situations for other pharmacists to do things in different practice settings. And I'll tell you a little more about that too as we go along. So let's start with hospital pharmacy. That's where I spent the bulk of my career. some of the things that pharmacists do in a hospital. First of all, that's where pharmacy residents are. So some people don't realize that you can do a residency similar to medical residency, which is like post graduation from the professional doctorate program, and it's a continuation of education, but you already have a license. Pharmacists participate in patient care rounds. They deal with ordering medications. The VA system in the United States, the Veterans Administration, allows pharmacists to initiate orders. Other hospitals have different rules as far as what they can initiate, but most hospitals have certain protocols where the pharmacist can decide what antibiotic a patient needs to be on, what the dose is, change the dose if the patient has bad kidney function and isn't getting rid of the medication, isn't clearing it as quickly as patients normally would, things like that, dealing with diabetic patients and initiating orders for taking care of those patients. So depending on what hospital you work in, you have different levels of freedom to order things. Creating policies, deciding what drugs will be stocked in the pharmacy, what drugs will be carried on the formulary. Antibiotic stewardship, which is basically going on rounds and helping to choose the best antibiotic for patients and making quick changes if things change. If they do like blood work and they find out that the infection the patient has isn't going to respond to the antibiotic the patient's on, the pharmacist has the ability to go and change that antibiotic. And sometimes in hospitals, physicians come like once a day and do their rounds, and so they might not be back until the next day, and the pharmacists are able throughout the whole night, to, as soon as lab work is done, to make changes and hopefully help the patients get better more quickly. Ambulatory care clinics are in a lot of hospitals. They'll have diabetes clinic, heart failure clinic, anticoagulation clinic, other types of clinics, and pharmacists will practice in all of those clinics. There are also standalone ambulatory care clinics that pharmacists will practice in. A lot of my colleagues at the school have practice sites in addition to teaching, where they will practice in ambulatory care clinics and then take our students to see what they're doing there. And also in the hospital, pharmacists are important in preventing adverse reactions. All drugs have the potential to do things that you're not expecting. Pharmacists are probably more aware than anyone else what those things are and kind of trying to prevent those, creating policies to make things safer for the patients. Pharmacy directors in hospitals, I say, are multilingual. Things that I dealt with that I had not necessarily thought I would deal with when I was first in school. Dealing with information and technology, creating the computer systems and creating like the rules that go into who is allowed to order things. Like, for example, oncology drugs, chemotherapy, you wouldn't want people who were not specialists in oncology to be able to even see those and choose them in the computer program. So you'd have to help create the security for those kind of things. Maybe having certain, patient parameters that would have to be entered into the computer before you could, for example, give someone an insulin shot. You'd have to know what the patient's blood sugar had been, and there's like a decision support system that we help write the programming for. Legal issues, the hospital attorneys used to call me a lot and ask me, well, what's the law about this? Are we allowed to do this? This doctor wants to do that, things like that. As I said before, there's a lot of regulation. The people that accredit hospitals, like the Joint Commission or the CMS, which is the Center for Medicare and Medicaid, Department of Health, the State Board of Pharmacy, all these people might at any given time come visit and want to look at your records for one reason or another. There's a lot of human resources issues. There's lots of moving parts, lots of different levels of skill of people that work in the pharmacy, and then they interact with people throughout the hospital. So understanding human resources issues. And I also worked in a couple of hospitals that had unionized technicians. And so understanding how that worked and what we were allowed and not allowed to do under their union contract, things like that. Creating budgets, so understanding the financial implications of the drugs that are chosen to be used in the hospital. Being able to communicate with the nurses and understand what they're up against. My husband always, I'm going to have to tell him, I talked about him twice in this talk, but he always said the nurses are like he's a sailor, the rudder of the ship, that they're the ones that if, they're kind of making things move smoothly. They interact with the patients, the families, all the different professionals in the hospital, and they're the ones everyone's coming to and asking questions. And I often feel like they don't get the respect that they should get in the hospital. So you have to be able to speak to the nurses and find out what's really going on with that patient. You have to be able to speak to the physicians too, and ask them maybe sometimes why they ordered something, and maybe suggest that something else might work better in a way that is going to not create friction. And then I ended up dealing with a lot of architects and engineers throughout my time working in hospitals. We moved pharmacies, we built new buildings, and just having to figure out how to read blueprints and talk to people about that kind of stuff was something I never thought I would be doing, but ended up doing at one point. These are some of the people that I worked with. This guy in the middle is a Canadian musician who ended up working for us part-time. His parents were ill and he needed just a part-time job to keep things going when he was helping take care of them. So he was a rock star. He actually played guitar in the movie Legally Blonde. Their band played the background for that music, but he was also a pharmacist. So in case you're thinking that they're all boring old men with bow ties, there's one guy that was a little more exciting. One of the most important things I think of working in a hospital is understanding teamwork, making sure that we all see that the patient is the most important part of our job, and the patient's outcome is what we're all trying to maximize. And I think it's really important for people to worry about the patient before they worry about how they'll look and how their department will look. So we have some committees in the hospital that create the rules. One of the most important for the pharmacy is called the Pharmacy and Therapeutics Committee. And it's made up of physicians, nurses, pharmacists, people involved with IT and safety, and sometimes administrators. And we would come up with policies for how the medications could be used. Like I said, some of the computer things and things like that. That is sort of evolving now to looking at some of the results of genetic testing, making sure that we're using the right medication for the genome of this patient. So a medication might work in 80% of the people, but the 20% that it doesn't work in, maybe we'd be able to identify that earlier if we ordered certain tests first, instead of trial and error and trying something, and then when it doesn't work, trying something else. Patient might improve more quickly if we deal with some of the what we call pharmacogenomics. So that's sort of a new thing that the P&T committee is dealing with. So I have my first case here is a hospital case. One of the things that we had to deal with all the time, and people who work in hospitals have to deal with, is shortages of drugs. And how do you allocate the amount that you have and decide what to do? So if you're able to buy only a small supply of a drug, how do you decide who can get the drug? So I don't know if you guys have some way to answer these things, or I don't know what your technology is, but one way to deal with it is whoever needs it gets it. First come, first serve till you run out. Second way is allocate to specific patients. Let the doctors decide. They're the ones that are ordering it, or don't answer the phone and hope nobody asks about it. And I have worked with pharmacists who sometimes acted that way. Anybody have any ideas? Well, I'll tell you what we did. We created a committee that dealt with these things and created like rules for how we would deal with it. There was one drug that was used for orthopedic surgery. It was actually a steroid, but it was believed to help premature infants that had low birth weight to improve their lung function. And so the question was, did we let the orthopedic surgeons use this until we ran out, or did we say no? And so what we did in this case is we said there's other drugs that the orthopedic surgeons can use, but there's nothing else that they can use for these little premature babies. So we brought all of it back. You know, most hospitals will have machines that are sort of like vending machines that the nurses can take the things out once there's an order active for a patient. We put the drugs all back in the basement in the pharmacy and said, no, we're the ones that are going to decide, and we're only going to dispense that when it's one of these premature infants. There was another drug called IVIG, which is an immune globulin, and it was being used at the time for all kinds of things. There were people writing articles and publishing things saying, well, hey, we could maybe use it for this, we could maybe use it for that. But, you know, we decided we had to really rein that in. And so we had like an algorithm that said, you know, these are the diagnoses that you absolutely can get it if the patient has this. Some people are born without a functioning immune system and actually need these immunoglobulins to be infused every couple of months. So those were the people who needed this to live that we saved it for. Once they all got it each month, we had a clinic. Once they all got it, then whatever was left, we could have like secondary indications that people could get it. So just some things that people might not realize is going on sort of in the background in the pharmacy. Community pharmacy, right now, one of the biggest things with community pharmacy is immunizations. And community pharmacists are the first healthcare person that a lot of people see, the most accessible person that a lot of people see. If people don't have money to go to a doctor's office or to go to a clinic, they might still go to the pharmacy. And so sometimes that community pharmacist is the only healthcare provider that they talk to. So that's sometimes important. They recommend over-the-counter drugs. You know, people will say, hey, I have this or that symptom. What do you recommend for that? They're sometimes the go-between between the insurance company who says, no, you're not allowed to have that, and the patient or the physicians, where the physician might order something not knowing what's on the patient's insurance, and then the insurance company tries to just deny it and not let the patient have that medication. And the pharmacist has to kind of advocate for that patient. But like I said, right now, pharmacists are sort of more prominent just because of immunizations with the COVID vaccines. I'm not sure if people realize that pharmacists work in nursing homes. There's the dispensing function. Obviously, a lot of people that are in nursing homes are on a lot of medications. So there's that part of it. But there's also some chart review that's required. The physicians are kind of in and out of nursing homes. You know, they're not there all the time like they are in their office or in a hospital. And so pharmacists are sometimes sort of a liaison between the different providers. And they also manage the controlled substances and deal with the security of those things. So I have another case here. You're the consultant pharmacist for an assisted living facility. You're reviewing a patient's medication and find several drugs that are contraindicated for a patient with a chronic disease that this patient has. So in other words, you shouldn't use this drug if you have this disease and the patient has this disease. So what do? So the alternatives are call the ordering physician and ask if he or she is aware of the situation, discontinue the drug per the nursing home protocol, or tell the patient they just shouldn't be using this. Any thoughts? I don't know if you're going to get a response or how that works. But there are a lot of reasons that a patient might be on an unexpected medication. So I don't like the idea of just using some protocol to stop it because they have a condition. So I would always try to encourage discussing it with the other providers for this patient and make sure that you understand what's going on with this patient. And there are exceptions to every rule that we have. So I think a good dialogue between healthcare professionals is really important, and that's what I would do in this case. So another area that pharmacists can work is industry. A lot of pharmacists, instead of doing a residency after pharmacy school, do a fellowship in industry. Many of the drug companies have fellowships. There's a huge fellowship program that Rutgers University runs that deals with a lot of different drug companies. And those people often end up going to work for those companies after a 1 or 2 year fellowship. And in the fellowship, they kind of learn all different aspects of the pharmacy industry, and then they might find out what area they like best. So there's people that are medical science liaisons. Those might be doctors, might be pharmacists. I've seen a couple nurses too, advanced practice nurses, who have done that job. And that would be somebody who might go out and educate the public, educate other healthcare providers about different drugs and how they work. There's obviously people that are doing research for all the major drug companies. And then there's managed care organizations. So kind of behind the scenes of the insurance companies, there might be pharmacists involved in helping to decide what the insurance company will cover, what tier they should be on. In other words, first you have to try something else before you can get this, those kind of decisions. So those are some different areas of industry that pharmacists work in. And academia, these are some different health fairs and poster presentations that I've been involved with some of my students. In academia, you have a lot more opportunities for publishing. These are a few of the journal articles and things like that I've been involved with. And I wanted to include the one that is kind of bolded here. Victoria Reinhartz is one of my colleagues. She was actually one of my students, and she now teaches at the same school I teach at. She also has a program called Paramedicine, and she's involved with the paramedics in Florida, and she goes into patients' houses and they kind of assess how the patient's living, what's going on, are they taking the right kind of medications? And what they're doing now is they're actually going into the homes of indigent patients who don't have any other way of getting vaccinated, and actually vaccinating those patients against the coronavirus. So she has a very interesting practice, and I was involved with writing this article with her, and she's actually starting a consulting business trying to help other paramedic units around the country involve pharmacists in what they're doing. Leadership. So somebody needs to be in charge of all these various areas that pharmacists work in. One of the things that's important in the hospital is there's no physician over the department, whereas like radiology, the lab, some of the other departments in the hospital will have a physician who is in charge of making the actual decisions for the department. In pharmacy, it's someone with a pharmacy license, a pharmacist who has to be there in order to buy the drugs for the hospital. So that was always interesting, because sometimes people in surgery would want to just sort of bypass the pharmacy, but they were actually using my license to buy the things that they wanted to use in surgery. And they said, well, we don't want you to have to send them to us. We want them to be here in our surgical suite. But we still needed to help decide what we should have, because it was my license that they were using to be able to buy that stuff. The other thing with leadership that I think is important is that when I started out as a sort of a baby pharmacy director, I always thought that I had to be able to do what everyone in my department could do just as well as them, or they wouldn't respect me. And I finally learned that everyone has their job, and there's people that are going to do lots of things better than I could do. And what I needed to do was support them and help them to be able to do their best. And I didn't have to do all their jobs, and I didn't have to understand everything they did, but I had to support them. So that's where I put this Steve Jobs quote: "It doesn't make sense to hire smart people and then boss them around and tell them what to do. You have to have them tell you what needs to be done." Advocacy. This is one of my students talking to one of our state representatives. Pharmacists have probably not been as good at that as like the AMA and some other groups, but we're kind of getting there. Professional organizations. I think in any healthcare profession, it's really important. And that's why I think it's great that you guys are doing this already, even before you're in a healthcare profession. Networking with other people, learning what they're doing, just having some support. I love that you have like the mental health support. I think those kind of things come with being involved in professional organizations, and it's really, really important in any kind of healthcare career. So that's what I have by way of presentation, and then I'm happy to open it up for questions and let the organizers here do their thing.
Oh, yeah, of course, for sure. Okay, so doctor, the first question that we have over here is, was it difficult, or how did you manage getting your MBA while being a pharmacy director?
It took me 5 years for a 2-year degree, so I did it part-time. I had 2 children at the same time too. So it was, a lot of time management, but I took it slow. I didn't do it in the full time in 2 years.
Okay, great. Okay, so another question we have over here is from Maria. She asks, what are the hours of a hospital pharmacist like, and what is the job outlook for hospital pharmacy?
It kind of depends on the size of the hospital. There are small hospitals that have like those vending machine kind of things that the nurses can use at night to access medications, but most intermediate to large hospitals will have pharmacists there 24/7. So there's night shift pharmacists in the bigger hospitals. My very first hospital, the one where I became the pharmacy director when I was 24, they actually closed the pharmacy for my wedding so that everybody that worked with me could come to my wedding, and had the nurses getting the medications out of the vending machines. But it was like a less than 100-bed hospital. It was a very small hospital.
That is very, very cool. Like it's like not just a job, but a family. So like we all strive for that work environment. It's amazing. Well, another audience member has asked a really important question. How have you balanced motherhood with your profession?
So for a while there, I kind of was on what you would call a negative trajectory for my, what you would expect for a career, because I was a pharmacy director before I had kids. And then I worked part-time after I had my kids. So part of the time that I was going to school and having kids, I just also worked part-time and worked second shift for a while. So that was actually my first career choice originally. When I was in high school, I thought I wanted to be a veterinarian, and worked at a pet hospital for a couple of years in high school. But my dad kind of convinced me, like I said, he was a pharmacist. He kind of convinced me that I could work whatever hours I wanted, as many hours I wanted as a pharmacist, because there are so many different places you could work. The managed care pharmacists work pretty much 9 to 5, Monday through Friday. They're dealing with insurance things and choosing what medications will be on formulary for insurance companies and stuff. And they work Monday through Friday. I worked second shift. So, my husband worked first shift, I worked second shift, and we kind of switched off the kids for a while when they were small. So that was one of the ways that my dad talked me into pharmacy school in the first place, was just because of the flexibility.
Okay, so there was definitely a lot of planning and time management, as you mentioned, involved, clearly.
Yeah.
Okay, so another question, another member of our audience asks, what do you think is the most difficult thing you've had to deal with in your role, and how did you handle that situation?
I have a couple of them. I taught an ethics class at school, and talked about a few of these situations. I would say probably the biggest one was when we first started doing physician or provider order entry in the computer system, which was, we got rid of all papers for lab orders and pharmacy orders and things like that, and everything was in an electronic health record. And it was a big hospital, and they first started doing this, and I wasn't happy with the plan. And the director of nursing was on vacation when they decided to go live with the whole thing. There had been one little pilot unit. And so I spent lots of hours talking to the nurses on that unit, day and night. I went in night shift and stuff, and they were not prepared, and they just kept showing me errors that were happening. And I did one of those, like, you see those movies where there's a new TV show, Rebel, that kind of somebody that stands on the table and screams, "You can't do this." I kind of did that in this case, and said, you can't make this hospital wide until we work out these bugs. And to this day, I still believe that I saved people's lives because of that. The doctors weren't using it. They were writing things on pieces of paper and making the nurses try and do it for them. And the nurses were overwhelmed, and the nursing director wasn't there to stick up for them. So that was probably the hardest. I feel like I burned some bridges with some of the administrators, but hopefully it was important enough that it was worth it to just say, no, we're not doing this. And I think the whole thing worked a lot better by slowing it down, doing another pilot unit, and making sure everybody knew what they were doing before it went hospital-wide.
You did what you definitely had to do. And I'm so glad that you were able to save lives, because today you're changing lives. Because I'm very sure that you persuaded a lot of people to pursue the pharmacy career. So thank you so much for all of your work. And so another audience member named Maria has asked, is industry pharmacy the closest pharmacy that gets to working with chemistry hands-on in the laboratory and equation-wise?
So there's industry, and there are people that are doing research. So obviously that's very much like, a laboratory. But there are also compounding pharmacists. So within like the community, it's kind of a niche where there are things that are not commercially available, and they work with physicians to say, okay, some hormone replacement things, some like creams and ointments, some other things that are not available, like without a preservative, and patients are allergic to preservatives, things like that, that need to be compounded. So there's a niche for that too, for people who like, playing with the chemistry of things.
There's definitely a place for every type of pharmacist in the field. That's for sure. Okay, so I'm really sorry about that. Okay. Okay, we're back. I'm really sorry.
Yeah, I was happy that my dog didn't bark through that whole thing. So.
Okay, so Victoria asks, in regards to public health, where is an area that pharmacists think should be pushed in health education and promotion?
Well, for me right now, I'm very aware of this paramedicine thing, and the fact that the article that I helped them with. So I teach pharmacoeconomics, so it's kind of like looking for the value in the financial gains and things like that, and they actually found that there were lots of people that were using the emergency department of the hospitals as their primary care physician. They didn't have a doctor. They didn't have access to a doctor. They didn't have transportation to get to even a free clinic. If there's not a bus route or something, people can't always get to those places. So a lot of those people were, every time they'd wait until they were so sick that then they had to go to the emergency department. And they found that they decreased the emergency room usage of those people by having the paramedic and the pharmacist going into their homes. So they saved, the health system, which was a county health system, a lot of money from the emergency department, but also the patients were taken care of before they got so sick that they had to go to the emergency room. So that's like right now, that's the public health aspect that I think is really important and kind of new.
Talking about the disparities is definitely very important to talk about. So thank you for this. And so an audience member named Aya has asked, well, first they talked about being a pharmacy tech at a community pharmacy, and they also want to become a pharmacist, just like you. However, they do not like the community pharmacist environment. They wanted to know, how does it differ from a hospital pharmacy?
So, as I said, when I first started pharmacy school, I thought that that's what I wanted to do. And I did it for a short while because I didn't really like that environment that much myself. And it really depends on what company you work for. There are some that are very metric driven, as far as, if you don't do this many of these things, we're going to cut the hours of the people working there. And I hope that goes away. I'm actually kind of hoping that that's one positive from the coronavirus immunizations, that they realize that there need to be more people working there. But hospital pharmacy is much different, as far as the staffing and the I wouldn't say that no one ever yells at you. You're when you're in a community setting, in a retail setting, especially as a tech, you're probably getting yelled at a lot. You're probably having angry customers blaming you for what their insurance company did or what their doctor didn't do and things like that. You're like the first person that they deal with. But in the hospital, you know, you have other people that are going to yell at you sometimes, but I think there's a lot less of that than, you know, the angry customer kind of aspect of it that you've probably experienced as a tech.
Okay, so taking that into account, like another member of our audience asked, which part of pharmacy was then your favorite to work in?
I really liked the health system pharmacy, the hospital pharmacy. I always kept trying to be more of a clinical person and kept ending up in some administrative role. And finally, I decided that was just my place and I was going to help other people do those jobs that I really liked. If I was going to start again, I would probably do something in ambulatory care. I feel like in community pharmacy, you see if you recommend something, if the person does it and gets better, that's a good thing. And you have a relationship with that person. In the hospital, your relationship is usually more with the doctors and nurses than with the patients. And sometimes you might make a recommendation and they get discharged from the hospital and you don't know whatever happened to them. Where I feel like ambulatory care, they're going to come back to you. You're going to get to make the recommendation. You're going to get to sit down and talk to the patient about what are they eating and why are their blood sugars the way they are. And then they'll come back in a month or two and you'll see if they got better, you know, if their blood sugars are under control and that kind of thing. So I guess if I was going to start again, that's what I'd do. But I've also really enjoyed teaching. I'm very proud of people who have been my students, like the one that is now my colleague that does the paramedicine thing. Other people that are hospital pharmacy directors and clinical people that run residency programs and things like that. So that's pretty fun too. So I don't know, I've liked them all at the time that I was doing them.
I can really see how you are a teacher because you have just taught us so much during the presentation today. Like we just learned so much. And so with giving advice as a teacher and maybe a mentor, an audience member has asked, do you recommend the LECOM 2+3 program in Pennsylvania?
So the program is actually a 3-year accelerated PharmD program. So, and you can get into it with using just doing the prereqs. So I'm thinking that's probably what they're referring to. It's tough. It's hard because it's kind of year round. There's breaks of like a week or two in between the different courses, but it's tough. And I think there's pros and cons. I think for someone who wants to get out in a hurry, for someone who has spent a lot of time in school and is ready to get out into the real world, there's reasons to want to do the faster program. People that have some life experience, I think that's good for them too. On the other hand, I guess I sort of can see both ways, because some of the things that you get with the 4-year program are summers off that allow you to work, and people are interning in hospitals and community pharmacies. And I think, like, as far as like passing the board exam, sometimes that's helpful. You remember the drugs and things from work as well as from the school books. So there's pros and cons. If you've already had some life experience and maybe some experience with the medications as a tech or something like that, and want to get out of school in 3 years, it's great.
Okay, great. Thank you for that advice. Following that same line, another we do know that your parent was one of your role models as him being a pharmacist. So what do you think are kinds of qualities that may indicate a good mentor or model?
I guess the first thing is that they're passionate about what they're doing. Um, there was, I'm going to mention my husband one more time. My husband went to pick up a prescription for himself and was talking to this guy who happened to be our neighbor and a pharmacist. And all he did every time my husband picked up his prescriptions was complain. He hated his job. He hated the people he worked with. My husband came home and said, "Do you let your students work in that pharmacy?" And I said, I'm gonna tell our experiential people not to let them go there, because that's not someone you want for a mentor. And he was in his 60s. He was crotchety. He had been doing the job for a long time. And maybe his manager was somebody that, was giving him headaches. I don't know what his, life problems were, but I think someone has to be passionate about the job. They have to be happy with the job they're doing in order to mentor somebody else. So don't pick that guy. He retired. Actually, he retired shortly after that. So I guess he was ready.
Yes. Students, when I said to take notes, take notes, because he just said some very good advice. And so an audience member has asked that, they said that they heard that it's currently hard to find jobs right now as a pharmacist, and if that is true.
I would say I have been in pharmacy while there have been some, peaks and valleys as far as my thesis, my master's thesis, when I got my MBA, was actually about dealing with the shortage of pharmacists. So at that time, there was quite a shortage. What ended up happening was, in response to that, a lot of schools that had nursing schools or med schools or something else in healthcare opened pharmacy schools. And the number of pharmacy schools doubled in the early 2000s, And so, yes, there were a lot of people, and probably are still a lot of people graduating. But at the same time, you have baby boomers that are pharmacists. So there's going to be a lot of people retiring over the next, 10 years or so, I would say, from that last wave of baby boomers that went into pharmacy. So there's that. To me, what I always tell my students is, you need to find the jobs that pharmacists can do. I feel like a lot of the community things that are more metric driven are going to be things that are going to be done by, either technology or technicians. We're training, the one textbook I wrote was for technicians. We're training pharmacy technicians to do a lot more. And I think what that should do is free pharmacists to find new places like this paramedicine thing, clinics, things like that, where pharmacists can be more kind of hands-on. And so I always try to encourage our students to think outside the box a little bit and look for places that need you. When pharmacists started working in physicians' offices, in clinics, that was kind of how it started. Was people said, "Hey, what do you think about this?" A doctor would say something to someone. I actually knew someone that this happened to. Doctors kept asking this person for advice, and she was always giving them advice about what to do with this patient and they weren't patients that were in the hospital. Like, he was picking her brain for things for his patients in his office. And finally he said, "You know what, why don't you just come and work in my office?" And they ended up creating this model where there's a way to do some billing. And that's one of the things that I always advocate with legislators, that pharmacists should get paid for doing that, not just get paid by the number of prescriptions they dispense. But there's some room for that, being involved in the first place, being the person that the patient talks to about certain things, like what they're doing in clinics, and then freeing the doctor up for being able to diagnose more people. And there's lots of different ways that could work, and people could find their own place and find a way to make money doing it.
I love that. Thank you. So, let's keep talking about how pharmacist profession, how the pharmacy field has been impacted, like in many different ways, as we're talking. So, how has your experience as a pharmacist been how has it been impacted by COVID? How has your profession changed, if it has?
For me personally, I'm teaching from home. I'm teaching via Zoom. Our students haven't been on campus now, for a year. They're actually starting to come back this summer for some of the labs and things that I mentioned that the distance education students have. And I feel like we were ready for it more than some other schools, because we did have we were the second college in the country that had pharmacy school via distance education. And so we were kind of ready for that. So that's what I've been doing. So that's been the impact with me. The student organizations, I'm advisor for some of the student organizations. They're all meeting via Zoom. So a little too much sitting in front of the computer right now.
I'm happy to hear that the adjustment period for you was not too shabby. And so the next question that we have here is, other health professionals who we have shadowed before have mentioned that there are sometimes big differences regarding on what they can do depending on the state that they are located in and are working in. Is this the same case for pharmacists?
It is. So the pharmacy license is, given by the state, and different states have different levels of, I guess, what the actual practice rules are. I came from Ohio, where pharmacists were allowed to do a lot of things. We had collaborative practice agreements, like this thing where I talked about the pharmacist working in a doctor's office. They had an agreement that allowed the pharmacist to take care of the doctor's patients, and the law in Ohio allowed for that. When I moved to Florida, it was not the case. It has since happened in Florida, but immunizations, I think, also happened in Ohio long before they happened in Florida. So yeah, there are some differences. A lot of our students have gone on to work for VA hospitals and the clinics. There's a lot of ambulatory clinics through the Veterans Administration. And the interesting thing about that is that you just have to get one license, and you could work at any VA in the country. You don't have to get a license in that state. And the pharmacists are allowed to do a lot of things in the VA that pharmacists can't do in, just out on their own. So they're allowed to order medications, prescribe medications, things like that within the VA. So there's differences with that kind of practice as well.
Okay, thank you for that information. So another member of our audience, we do know you mentioned that you completed a bachelor's degree in pharmacy, if I'm not mistaken. So they asked, what about the prerequisites when taking on the path of pursuing a PharmD degree? Did you have to take any other courses additionally, or was it easier in a way just because you already had a bachelor's degree in pharmacy?
So I was sort of on a soapbox once when I went out to dinner with one of my students, really good student, really smart. Like, if she wasn't number one, she was a number two in her class. I don't know for sure, but and she's currently in charge of an infectious diseases residency program at a big hospital in Florida. So we're sitting there at dinner, and I said, boy, I don't like the way this is going, that you don't have to get the bachelor's degree. I feel like people should get a bachelor's degree because they learn a lot more than just exactly what you need for each of your classes. You should have some like humanities classes, and you should learn more stuff. And I wish we hadn't done away with that need for getting a bachelor's degree. And she looked at me and she said, "Do you know my background?" And I said, "No." And she said, "Oh, well, I don't have a bachelor's degree. I went to a community college and did the prereqs. And by the way, I never went to school. My dad was a farmer who homeschooled me." And so, I think it depends on the person, because this woman is one of the most brilliant pharmacists I've ever worked with and knows more about infectious diseases than many physicians that I know. And she had a different path. She just took the prereqs. She was homeschooled, although she told me her dad made her do algebra when she was in what would be second grade. So he didn't want her to have to wait till everybody else had it in their curriculum. He thought she was smart enough to do it. So I think there's different paths. I would not, she put me in my place, and I would not say there's only one way to do it ever again.
That really takes the expression "all paths lead to home" in a whole different light.
Yeah.
And so you you were talking about the process about creating the textbook. Can you talk about that process? Like, was there any collaboration? Like, there must have been a lot of information out there for you to gather to form one textbook.
So the first book I wrote was for pharmacy technicians. And what I thought in my practice in the hospital was that the technician, well, I'll tell this story. I'll try and make it brief. There was a terrible accident that happened in Ohio in a hospital where a technician made a chemotherapy drug wrong, and a little baby died. And I was in practice in Ohio at the time, and a lot of laws changed as a result of that. And technicians were required to be certified and licensed, and that's now happened throughout all the states. But it happened there first for a really bad reason. And so as we were putting all of our technicians through this coursework that they had to do, I felt like it was all about just doing the right math and calculations and things like that. And I felt like if we're going to give more to the technicians and let pharmacists do some different things, the technicians needed more of a well-rounded education. So, and then the stuff that I've been teaching in pharmacy school as well, management, how to get along with people, thinking about safety, things like that. So it was a lot of those more, I guess, soft skills and less of just the science and math that I thought there was a need for. My son illustrated it, so that was pretty cool too. So that was my collaborator in that book. The second book was actually, I co-authored it with one of my favorite students. So she works in managed care and had some insight into things that I had never done. And so she wrote those chapters, and I wrote some other chapters, and that was really fun to work with her.
That honestly sounds really, really cool. Okay, so another question we have over here is, were you involved by any chance in any research during undergrad, and would you recommend this for students interested in going into the pharmacy field?
I was not, but I'm thinking of like students that we've had, and I think some of the really, really standout students have been involved in some kind of research as undergrads. One of my advisees did a lot of research as an undergrad and was really a great pharmacy student, did a residency, and is now a clinical pharmacist in Virginia. And yeah, I really feel like that helped. I don't think it's necessary, but it's a good thing to have kind of in your toolkit.
Yeah, just gaining any sort of experience and being an advocate is really helpful in getting to know pharmacy because it's very complex. And so how would you advise us in keeping up with like the pharmacological advancements? How do we stay informed?
Read a lot. There's so much information all the time that it's overwhelming. So, I would say don't overwhelm yourself, but um, read from reliable sources. Don't just read dumb tweets from people who think they know things.
Okay, so another question is, have you ever experienced burnout in your profession, and how did you deal with it?
Um, I guess part of the reason I ended up going into teaching was sort of a burnout thing. The level of responsibility that I had. I was at the time the pharmacy director for a 6-hospital system, and I would say that sort of started to get to me, and I dealt with it by getting a little calmer life. At this point now, when I mess up, the students laugh at me. At that point, if I messed up, someone could die. So it was a lot more calm to just have students laugh at me when I mess something up.
All right, unfortunately, this is our very last question. And so we were wondering, do you have any future career goals as a pharmacist? And if you have any advice for possible future pharmacists in the audience today?
I don't know. I feel like I've spouted a lot of advice. um, I would say read a lot. Learn to manage your time. But again, I think it's really important to have a balanced life, to do some fun things, to have good friends and family, not to solely concentrate on school, but spend quality time doing the studying. The people I know that have struggled in pharmacy school, I've had some advisees that had to like repeat a year or ended up not making it in school at all, and most of them were people that spent hours and hours saying they were studying, but they really weren't. They might have had 3 things open on their computer at the same time. They might have been doing something with social media. They might have been, whatever they were doing, they weren't really focused. So it's not the hours that you spend studying, it's the focus that you have. Study well and then go have some fun. Don't spend all of your life with your computer or textbooks open and think that you're doing yourself a favor.
Okay, I believe we should a lot of us should take that to heart, and I think it was definitely great advice throughout the whole session. So I definitely wanted to thank you for this amazing presentation, Dr. Peshek. So, okay, so I think we're ready to wrap up. I'll be putting up the wrapping up presentation over here. Okay, so considering this wonderful presentation, you guys, I think we would like to encourage everyone to reflect on this session today with these 3 questions over here. So what brought you to this session today? What are 3 major takeaways you got from it? And what do you want to learn more about? You can take a few moments over there to maybe write it or just answer those questions in your mind, just reflect a little bit because we definitely learned a lot from this session, I'm sorry. We do want to highlight though that The writing is not required. However, we do encourage you all to submit it to our website for publication for recognition of your hard work, as we mentioned earlier, and to definitely enhance your future applications. Of course, if you want to learn more about pre-health shadowing and how to get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion. We are also accepting team members' applications if you want to take on a more active role in PHS to lead projects and initiatives to be up here with us. Once again, we are humbly asking that if you're financially able to donate, that you please consider doing so. It costs a lot to keep our program up and running and free to all of you. So if you are someone who can afford it, or if you know someone who can, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask to spread the word about pre-health shadowing to reach as many students as possible. Okay, now the moment that we've all been waiting for, right? So earning a digital certificate for the virtual shadowing hours from this session today. First, you're going to go onto our website and find this professionals course pages, Dr. Peshek's page, right? Next, you can take our quick 10-question multiple choice quiz based on the content from the session today. You will have 30 minutes per attempt to earn 70% or higher to get your certificate. We do know, of course, that sometimes technology can be difficult, and for this reason, we allow up to 2 attempts to take the assessment. But if you run into any difficulties, please do not hesitate to contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting 30 minutes to an hour approximately after the session to take the quiz, which will be open, of course, indefinitely. We're highlighting that part, it's open indefinitely. And finally, once you have passed, you can click the Finish Course button at the bottom of the professionals page and download your certificate verifying your virtual shadowing hours. If unfortunately you missed a part of this session or you want to go back and view other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our website previous recordings. You can also find them via the professional pages on our website and take the post-shadowing assessments for these as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events. We are currently booked every weekday through June for virtual shadowing sessions, so we definitely hope to see you guys over there. Once again, thank you all for joining us today, and please do stick around if you have any questions whatsoever, and our team members will gladly answer any of them. The shadowing session is officially over, and I invite you all to log off.